Are you ready to listen? Because I'm ready to talk. And right now I'm going to talk about me. I'm going to talk about my current diagnosis. My current diagnosis is narcissistic, which, you know, big word. Unstable control of my emotions, emotional instability, and borderline personality disorder. Now, that means two things. I'm going to swear in a minute. Number one, narcissistic means basically you're selfish. Number two, it means I can't control my emotions. Number three, it means I'm just a bit all over the place, which means I'm a selfish asshole. That is basically what I come up with. I come up with that I'm a selfish asshole. Now, am I? I can be. I've done things that make me that. And I'm going to talk about them in a minute. But there's also another diagnosis, and another one, and it scared me a little bit. I did a little bit of research. And that diagnosis is very close to that of a psychopath. And, you know, somebody that runs around and is a serial killer, and it's like, am I a serial killer? No, my lawyer told me to say that. No, I'm not a serial killer. Please don't come and dig up my garden. I'm doing it now. So that's confusing. So what I'm in the process of doing right now is I'm in the process of going back through the NHS system of seeing a psychologist, a psychotherapist, or whoever has got the qualifications and stuff to help me. And first of all, I want an understanding of the diagnosis, because with that diagnosis, that doesn't help me. That doesn't say, right, so that that's who you are. There you go. End of. Okay, so why do I feel low all the time? Why am I aggressive? Why have I got all these tendencies and things? And that doesn't help. It doesn't fix me. So I'm going back through the NHS system. I've missed one appointment already, ironically, due to my depression and my messed up sleep pattern. And this is a constant, ongoing thing. I miss appointments, and the NHS, unfortunately, even though it's free at the point of use, they cut you off. And people in my position, I feel that if you tell us in 2 months' time you have to be here at 2 o'clock in the afternoon, we will do everything we can to try and be there, but then we've got that little niggling voice of depression in the back of our heads. What's the point? Why bother going to this? It's not going to achieve anything. Nobody cares about you. Don't bother going. Stuff them all. And you've got that in the back of your head. And you might manage to push through and get to the appointment. But I would say quite a few don't. And that's my first criticism of the NHS, is you can't cut somebody off from treatment because they didn't attend, if the reason they didn't attend is because they haven't completed the treatment. But then they also can't waste the money and the resources of a counsellor, a psychologist, a therapist, or anything like that. They can't waste them resources on people that are never going to turn up. So I think they need to change the system a little bit, maybe. Maybe if you miss 2 or 3 appointments in a row, then yeah, absolutely. You could have possibly made one of them. I think you should be given 3 opportunities. But if you attend an appointment, then miss an appointment, attend an appointment, miss an appointment, I think that becomes a bit of a grey area, because that might just be the only way you can do it. And maybe then you need to try, and if it was a weekly appointment, make it a 2 weekly appointment and see if that can and keep going. Or if it was a 2 weekly appointment, make it a monthly. If it was a monthly, make it a 6 week appointment. Maybe it's something like that. I think there's ways that we need to look at that. So currently that's what I'm doing sort of with the doctor. I mentioned in a recent video, which is why I'm wearing the same outfit. I genuinely thought about changing. I just thought that would be a little bit vain, because you can quite clearly see I'm still in the same position. It's still night time. No, I wasn't going to go and change just for the sake of a video. Maybe I'll start doing that. I did say if I get to 1 million likes I'll dress up as a woman and do it, but in fairness, if you ever find out what other channel I've got dressing up as a woman, you'll find it is nothing. Why are they two not linked? Because at the moment I don't want them linked. I will, I'm sure, at some point say, this is my other channel, please go there. The reason they're not linked at the moment is because people on that channel, I don't want coming over to this channel. Because the people on that channel are looking for a very, very different thing. That is a comedy, me being an idiot and doing stupid stuff. And at the moment I just want to keep you guys here in my little bubble. Mostly because these videos are hard. Because the other videos, that's me being an idiot. That's me doing very stupid things. Coming up with very, very crude jokes. Quite sick, disgusting jokes. And again, that's a fake smile. That is me hiding behind that humour. And, you know, so I don't want people that are watching that to then come over to this site and be like, oh god, he's a miserable git, fucking hell, I don't want to deal with him. So yeah, I just want to keep them separate for now. I hope you guys understand that. If you do find it, please enjoy it separately. Maybe, actually, you know what, I've just thought, go on it. I'm gonna leave I'll work out how to leave a link. It's called Humour of Hell, HOH. It is literally, there's like 7 or 8 videos on there. And it is basically me doing stupid stuff and chatting crap with friends. One of them hopefully will be on this channel soon, because we're going to talk about other things that's going on there. And yeah, so yeah, Humour of Hell. I'm an idiot. We have a stunt coming up soon that I genuinely think I'm going to cry when we do. There we go, just sorting out my bra. But yeah, so that's that going on. Anyway, back to sort of what I'm doing at the moment. Help me, I'm on medication. So I'm on a tablet called venlafaxine, 225 milligrams. Apparently I can only go up once more, but that's got to be done by a psychological consultant. I'm not sure what it's meant to do, but what it does for me is I have a temper, and I'm not going to go completely into my temper on this because I want to do this as a separate video. But I do have a temper, and I do struggle to control that temper. And the tablets, when I'm on the tablets, they help me to process. They help me. Whenever you've lost your temper, I bet somebody at some point has turned around and said, "Why don't you count to 10? Because by the time I get to 2, I'll have hit them." You know, it just, I know it doesn't work. For me, having that tablet gives me that automatic count to 10, and by the time I get to 6, I've calmed it. So it gives me that time, it gives me that freedom to be less aggressive and everything. And again, I'm going to go into more detail about the aggression in another video. Maybe again, I might film now. I'm not planning on going to bed because of the other tablet I'm on, which is Astralopram, which is 20 milligrams, which is the highest dose I can get. That one makes me a little bit hyperactive. Now, I've actually been off it for a week. I stopped taking it because I went, it's not doing anything. What's the point? I don't want it anymore. Stuff it. I don't need it. There's no point. I never stopped taking my venlafaxine because the side effects of stopping taking it, I would sooner come off heroin and alcoholism and cocaine and marijuana and caffeine. I would sooner come off every single illegal substance in the world than miss one day of venlafaxine, because it is atrocious, the side effects that you experience. You get shakes, you get headaches, you get nausea, you get dizziness. It is truly horrific. So, with that said, the the escitalopram, I didn't actually feel like it was doing anything. I didn't feel better. It wasn't helping with my sleep. It wasn't doing anything. So I didn't bother. I just, stuff it. I don't care. I don't want it anymore. And I didn't bother ordering it. I just left it. Well, approximately 10 hours ago, I went back to the doctor's. I was very lucky to be able to talk to the doctor for over an hour. I was his last patient of the day, so he just talked to me. And I think talking helped a lot. And I got my tablets, and I took them because I had felt really down for a week. Down to a point that the weekend that I actually made an attempt to end my life. It's a lot more real when you say it out loud. And my partner went here, my kids went here. They were out. They were staying over at their mum's, my partner's mum and nanny. And I was just in a real dark, low place, and I was stupid. I am fine. No lasting damage. But I knew I needed to go back to the doctors, so I got back into the doctors, spoke to them. That was good, and I've gone back on the escitalopram. I can't pronounce it properly. Escitalopram. I've gone back on that, and so that's given me a bit of a buzz. It's made me a little bit hyperactive, which might be why I'm talking 1,000 miles an hour, and I do apologise for that. Yeah, so back on that. It's given me a bit of a buzz. It's good. It's very good. So, what could I have done? I don't really know, and we have a very strange system. I don't know, hopefully there's people all around the world, and I don't know what medical services you have available to yourselves. I know, and just know deep down inside there is going to be somebody watching who doesn't have an NHS, doesn't have anything available to them, doesn't have medication available to them. So I am fortunate that I have that availability. But that's just keeping me ticking over, and I often question whether medication and things like that are the right answer. Again, a criticism I have is I speak to so many people who have had a situation happen like they've lost a relative. Now, absolutely 100% losing anybody is painful. But I do not agree, wholeheartedly do not agree, that you should be given antidepressants for the loss of, say, an aunt or an uncle. The loss of a mother, depending on your age. You know, if you're in your 40s, 50s, it's going to hurt. But it was going to happen. And I would like to make it clear that this is not a blanket, I don't think anyone should. This is, I think it needs to be looked at. I genuinely think that grief is something that happens in life. And if we are given antidepressants every time we experience grief, how can we deal with certain things like that? And I think it is a circle of life. It is the nature of life, that life ends. And if your mum or or dad dies of old age peacefully in their bed, you have every right to be upset, sad, angry. You have every right to feel every emotion in the world, and including depression. But I think you should feel that. I think you should go through that, because people have been going through that for a long time, and it seems that we've become reliant as a society on medication to get us through stuff we should be able, as human beings through evolution, to be able to get through. So, why do I get a tablet? Because of my temper. Because my temper isn't normal. It isn't something that is meant to happen. Why should I have a tablet to make me feel a little bit happier? Because I haven't lost anyone. I haven't had a stressful moment in life. There hasn't been a point that can make me go, oh, this is why I feel low. If there was, then I could maybe go and deal with it. I just every day wake up like that, and that is an abnormal event. And grief and certain other events in life are what I would class as a normal life event. And I think for normal life events, we have to question when we should be dealing with it through ourselves and through friends and through family, and maybe bringing down our own fake smile and bringing down our own walls and barriers that we put up, and opening up to people. I genuinely, I really believe opening up to people is a help. You have to find the right people to open up to, without a shadow of a doubt. That is necessary. And with that opening up, we can go forward and we can move forward. So, from that, I'm going to conclude this up a little bit. I'm going to sort of wrap this up now and sort of say that if you need help, ask for help, whether it's through grief or anything. Grief counselling should always be, in my opinion, a first stop before medication. That is my personal opinion. And I think counselling should be a first option for mental health conditions, unless they are, seriously affecting quality of life, maybe is the better way to put it. Or if you're a risk to yourself or you're a risk to other people, maybe. Without my medication, I'm a risk to myself, I'm a risk to other people, and my quality of life is non-existent. I basically exist to eat one meal a day, crap in the toilet, go back to bed. That's my existence without medication. On medication, it's a little bit better than that. Not much, but it's a little bit better than that. I might go to the toilet twice a day, just for a treat. No, I mean, you can see I'm here, I'm filming this, I'm back on medication, I'm able to film this. I don't know how long I'm going to be able to film for, so seek counselling. That might be with a professional, but you have to consider close friends, family, estranged friends or family. It might be a family member that you're not overly close to, but you know that they're good listeners, they're good talkers, they're good at advice. I think we need to lean on people's and our own humanity before we look at drug intervention. And I say this having had counselling for many years, since I was about 7 years old. So 23 years on and off I've had counselling. The longest stretch of counselling for us for about 3 years. So it's not that I understand counselling doesn't always work as well. So I completely get that. But I'm just, my opinion is of counselling first, medication second. If counselling isn't helping, then obviously, and all of this you would discuss with your GP, but I do think some GPs are handing out antidepressants to the wrong people. And I haven't talked about handing out antidepressants to under 18s because I think the rules have changed a little bit. I'm not 100% certain, but I was on fluoxetine at 13, which is an antidepressant, and yeah, it doesn't help me. It doesn't actually do anything really for me. But I just think at 13, even though I had big problems at 13, I think very young to be given medication, considering that I've now been on venlafaxine for nearly 7 years I've been on venlafaxine, so there's no end in sight to me being on that either, and it can only go up in dosage one more time. So I remember I went from 125 milligrams to 200 milligrams quite quickly, and then 200 milligrams I lasted on for nearly a year and a half, 2 years. I've been on 225 milligrams now for a while. I'm hoping that lasts, but what happens if it doesn't and they need to go to 250? How long am I going to be on 250 for? Because I can't go up, I can't go any higher than 250. What happens if my body builds a tolerance to it? So yeah, I think that is the problem with medication. There's a dependency, and there's a never-ending sight. So yeah, I think we need to think about how we do approach life situations over sort of abnormal life situations. And I'm feeling low, feeling depressed, feeling like you want to kill yourself, feeling any of these emotions, feeling like you're in the wrong body, feeling abnormal for a completely abnormal reason. You know, if you don't feel normal because you feel like, you know, if you're a man and you just everything appeals to you more for women to be a woman, then you feel abnormal because you don't feel like you're in the right body, and it's an abnormal reason because you don't feel like you're in the right body. That is abnormal. If you're in the wrong body, that is abnormal. That's not a life event. You were born in the wrong body. So yeah, I hope that's in kind of giving an understanding of sort of where I am in sort of my position with my medication, my treatment, and sort of what I do, and you know, hiding behind a little fake smile and doing my other channel. You know, that does help a little bit as well because it makes me forget. You know, you'll see me doing stupid stuff where I put myself through pain. I'm going to say it on here, I'm not going to say it on there, and I hope you guys appreciate that I'm trying to keep the two separate a little bit at the moment. But I do them stupid things and put myself through pain and put myself through extreme circumstance because I self-harm. I have a number of old, I don't know if the camera will pick it up, I have a number of old scars. This is one that I'm currently just yanking at the moment. That's a fresh one that I'm yanking at. I just basically find fresh skin, rip it off. It's scar tissue, and I rip it off. I bite my nails to the point that they bleed. Oh, I did the elastic band thing for a while. I used to cut myself with scissors. What else did I do? I used to sort of at school I used to get my tie and tie it up to the point that it cut off circulation. Many times teachers had to cut my tie off with scissors. The school refused to let me come to school without a tie, so I just carried on doing it. That was more me being a jackass than anything else though. So yeah, I do self-harm, and partly in them videos I am self-harming a little bit, putting myself through an extreme because I'm in control of that extreme, so that's why I do it. Again, hope this video has made a little bit of sense to somebody, because I have no idea what I've just rambled on for. I hope somebody else has some comments. You know, do you agree with me that sometimes life events we kind of rush into a doctor and getting tablets when we should be dealing with them? Do you disagree? Do you think, actually, wait, you know what, you know, get pills, pop them, you know, you shouldn't have to deal with the loss of family or anything like that? And again, I want to make it clear that I'm talking about a normal life event. If a family member has been horrendously murdered, I don't think anyone's really meant to cope with that. So it is down to the individual circumstance. So yeah, shoot me a like, dislike, subscribe, don't subscribe, please subscribe. I need to feed myself more than one meal a day. Your subscription could feed me again for a second meal. Probably another McDonald's. That's all I eat is McDonald's, which is why I'm fat, which I will talk about in another video. And I've got nothing better to do, so I might do that now. But I think maybe I should get changed, because it's going to look weird, isn't it? I don't know. Subscribe. Write down in the comments, does it look weird if I do lots of videos wearing the same clothes? Should I change clothes? Anyway, like. Still don't know how to put that on the screen yet either.